Hello everyone, hope you are having a good day. As you are aware about the situation in the country about the virus outbreak, we are not able to take lectures and hence we are preparing such online means through which you can learn, you can study, and we can directly interact. Today we are going to see something about evidence-based seminar. We already discussed what is an evidence-based seminar. This is a demo seminar which I have prepared in the past and presented. So what are the contents we'll see? And we'll start first of all with the topic. As you know, part of our syllabus, virtual reality based rehabilitation program on post-stroke patients. What are things that are included? So first of all, there will be introduction to what things you are using, your title. So if you can see the title, the first thing is virtual reality. Then rehabilitation on post-stroke patients. So first of all, what is VR? What is virtual reality? Second, introduction about virtual reality and stroke. Then why the thing is important, why your intervention is important in the premises you are going to give, in the population that you are applying. And next, most used common headsets or consoles, specialized sensors in VR, consideration and drawbacks as to what we know till now, what are the evidences, conclusion, and references. Yes, the initial five things. What is VR? Introduction, VR-based rehabilitation, most used VR headsets, specialized sensors, and consideration and drawbacks. All this can change according to the intervention that you are going to give. For example, effect of Mulligan mobilization in frozen shoulder. So what is Mulligan mobilization? That would be a starting. Then would be what is frozen shoulder? What is the prevalence of frozen shoulder? But last three things, if you can see, yes, evidences, conclusion, and references remain common. Yes, because we are seeing an evidence-based seminar, evidence-based physiotherapy practice seminar. Hence, we'll start with the first thing, what is VR? So, as we have discussed in the classes, as you already know, just a brief introduction. So, computer-generated simulation of three-dimensional image or environment that can be interacted with a seemingly real or physical way by a person using special electronic equipments such as helmet with screen inside or clothes fitted with sensors. In recent years, use of virtual reality has focused on games and adventures through headset, helmet, glasses, and other sensors. Is a technology novel adjuvant therapy that can be used to apply in neuro patients for the purpose of neuro rehabilitation. We have seen all the things in detail. What is virtual reality? How it is useful? What are the drawbacks? This is a brief revision, and more important, how to prepare a seminar. VR is becoming increasingly popular as it is easy modifiable according to the need of the individual, perceived as being fun and motivating. It allows researchers to incorporate elements such as feedback that have shown to maximize motor learning. Also, why is it important in rehabilitation? New scientifically based treatments have considerably increased in reporting of therapeutic and rehabilitative strategies. Such therapies like treadmill training with partial body weight support, or robotic assisted therapy, virtual reality, they have increasing. Why are they increasing? We have seen their advantages over the conventional treatments. Studies in computational neuroscience have demonstrated that virtual reality technology provides enhanced feedback about movement characteristics, improved motor task learning, executive healthy subjects compared with traditional, that is conventional training. Also, exploiting the VR features, several authors have given aimed at relearning motor function in post-stroke patients. A recent coherent review, what is a coherent review we have seen, assessed the effect of VR treatment on recovery of motor, gait, balance, cognitive function, and ADL in stroke patients. The conclusion was that despite encouraging results, strong evidence of better effects in favor of VR therapy compared to conventional therapy is still lacking. Hence, it is a new emerging field. There are not many researches done, but now as the time is passing, everyone is incorporating new researches in the field of VR, and hence its use is now advisable. Conventional physiotherapy is a slow. This provides instant feedback and motivates the patient. And more importantly, patient does not do activities like shoulder flexion, shoulder abduction. It is a mix of everything. Hence, they are all related to patterns, synergies. And that is aimed by such intrusive games, not by our conventional physical therapy. Patient is not worried about how his shoulder will gain the rest of the 90 degrees or 20 degrees. He is more efficiently gained or benefited only by reaching higher shelves. That is the aim of that individual, not to gain those 20 degrees, but to gain functional tasks. Most used VR headsets or consoles: Xbox 360, PlayStation 4, now 5, Google Cardboard, Daydream, certain VRs, everything. Yes, so this is, you have seen Xbox, PS4, Google Cardboard, everything. Such cardboards are easily available at the price of 400, 500, but they can also be helped to rehabilitate the patient. Specialized sensors connect for Xbox, PlayStation, VR, especially VR. You've seen the ads. Any mobile compatible VR headset like this. Yes, Google Cardboard. These are the sensors. You can see this is Oculus, Samsung Oculus. This is the complete PlayStation kit. This is Kinect sensor for Xbox. So what are the treatment plans? You need to discuss the treatment plans. What all things are to be included in your evidences that you need to discuss. So no specific treatment plans available commercially, no standard equipment or platform are used or set by therapist. This is a drawback. We already discussed everyone is using all the games that are available for different populations. Treatment plans vary according to the patient's need. Large number of games are available for specific functional tasks. Time factor also varies according to the need of the patient and the therapist. However, 30-minute session for about 4 to 12 weeks usually shows significant improvement in functional activities. So a baseline is prepared 30 minutes for 4 to 12 weeks every day gives a preferable outcome that will help in neurorehabilitation. Consideration and drawbacks: range of motion, voluntary control, spasticity, synergy pattern, uniformity in treatment, costing, and technical consideration. Yes, what is the advantage is range of motion? Not very sure. Voluntary control, it increases, but how much, in what time? Not very sure. Spasticity, it decreases or is being maintained? Not very sure. Synergy patterns, they break or they might get an add-on effect depending on the spasticity. As we know, spasticity is the prime concern related to abnormal synergy patterns. Uniformity in the treatment, as we have talked, various games are there, all are using different games, so there is no uniformity. Costing, as you know, the equipments may cost in thousands if we are going for professional equipments. Technical consideration, the therapist, the patient, the operator must know how to be technically efficient in using these conditions. So VR plays an important role. Understanding the technology and implementing it requires some effort, some energy to be put in again. So this was all. Next, we are going to see the evidences. So you need to follow PICO format, PICO. P stands for population, I stands for intervention to be given, C stands for comparison with what you are comparing the intervention you are about to give in the population, and O are the outcome measures. So this you will form from the articles that you will find on the internet. From there, you will see what is the population. The title itself had the population post-stroke patients. Intervention, as you know, we are giving virtual reality-based rehabilitation. Comparison with the conventional therapy and outcome measures. These will be the outcome measures mentioned in the articles that you will be searching throughout. So FIM, Fugel Mayer Stroke Assessment Scale, sit and reach there. These are few of the outcomes that you will find. How to write evidences. This is the first evidence. You will give the title as the title of the slide. Virtual reality for stroke rehabilitation, a systemic review done by, these are the authors, published online when, what was the aim, what was the method, what was the conclusion. Conclusion plays an important role. Virtual reality may be beneficial in improving upper limb function and activities of daily living function when used in adjunct to usual care to increase overall therapy time. This is the second, again given by whom, given by when, time is important, what was the aim, and finally the conclusion. The current evidence of the effectiveness of using VR in the rehabilitation of the upper limb in patient with stroke is limited but sufficiently encouraging to justify additional clinical trials in the population. This is the third meta-analysis. This is the fourth prospective controlled trial. And this is the fifth randomized control trial. Yes, so minimum of 5 or 6 such articles are to be seen, put together. The higher the level of evidence, it is the better that your evidence-based seminar will be good. Next, how do you sort which will be first, which will be second? You will have to depend on two things. You can either go first on the level of evidence. So if you can see, randomized control trial is the least available evidence. Before this, we saw an meta-analysis. This is the highest level. This is the systemic review. That is the second level. But here I have decided to go with date. So if you can see, published online on 2017, November 2017. Second is December 2014. Third is March 2014. Fourth is 2013 August, and the last one is October 2013. Yes, so accordingly, I have prepared this on the basis of timeline. The more recent it is, I put it first and after the older ones. You can also go for level of evidences as discussed. So at the end, this is the final conclusion from all the evidences that I have quoted. What is the main conclusion that I will draw from this seminar? So all articles support use of VR-based rehabilitation as a tool to improve upper limb function in stroke survivors. This therapy needs more investigations to further prove the effectiveness because the level of evidence is less. However, VR-based rehabilitation is new emerging treatment for stroke survivor can be easily incorporated as part of home exercise program too. Clear? So this is my final conclusion. After this, these are the references that I've taken everything from. References can be 2, can be 5, can be 15, does not matter. Most important thing is the conclusion part of your seminar. Now, as you have seen what is the anatomy of a seminar, we have already seen the scholarly articles anatomy. Similarly, you are supposed to prepare one evidence-based seminar on the topic that you like. It should be very recent, should not be from the books itself. You will find 5 evidences. Go for the introduction. Go for what is the therapy, why it is used, what is its advantage, what are the limitations, then evidences, then the conclusion and references. You're about to prepare, you have to prepare a PowerPoint presentation for this. Once you do this, you are supposed to update this in Google Classroom. Soon your batch will be reflected in Google Classroom. We'll be making it and you'll have to update the same in the classroom. Yes, so this is the assignment. The final deadline for this is on today is 24th March. We'll be publishing this directly on the YouTube. So by 28th, you have 4 days. You have to submit the assignment and upload yourself. The marks for CE will be based on this. Yes, thank you. Hope you understood. If you have any query, you can kindly contact me at any time. Thank you.